Hello, and thank you for joining us for Medical Cannabis, What You Need to Know. Cannabis has a long history of medical use and has been legal for medical use in some states for decades. This session will talk about using cannabis medicine, including potential benefits, adverse effects, pros and cons of modes of use, and other important considerations. Our speaker for this session is Keeley Trentham. Keeley is a registered dietitian nutritionist and a board-certified specialist in oncology nutrition. You can view her full bio in the downloadable conference program. Thank you so much for joining us, Keeley, and I will now turn it over to you.
Hello, my name is Keeley Trentham, and I'm an oncology dietitian at MultiCare's Regional Cancer Center in Tacoma, Washington. And I'm delighted to be able to talk with you today about medical cannabis and what you need to know. So, some things we'll talk about today. I'll give you a brief history of medical cannabis use. We'll talk about whether it works and for what conditions. We'll talk about the pros and cons of the different forms of cannabis. And we'll talk about reasons not to use it and potential adverse effects. So first off, let's talk about what cannabis is. Cannabis is a plant from the Cannabaceae family that also happens to include the plants hops, pretty well known for its role in making beer, and hackberry. And I think it's important to point out that while cannabis goes by a lot of slang names such as grass, weed, ganja, marijuana, etc., it's still the plant called cannabis. Often people who utilize it as a medicine prefer to use the plant name for it. It helps to destigmatize the cannabis to not use some of the slang names. So a quick history tour. Cannabis has been used for medicine since before written history. And the earliest written history we have seen about cannabis for medical purposes was found in texts from over 3,500 years ago in Egypt, and also was found in texts from 1st and 2nd century China. They had a compendium of medicine composed during that time frame in China that named cannabis as a medicine for various conditions. Cannabis was first introduced to modern Western medicine in the 1840s when Dr. William O'Shaughnessy noticed that he could use it to help palliate the symptoms of rabies. And it was used for a while in Western medicine. And then in 1937, it was effectively banned in the United States via a very high tax that made it unavailable to people because of the monetary cost. And then it was removed from the United States Pharmacopoeia or Compendium of Medicines in 1942 at the upset of many physicians. In 1970, it was given Schedule I classification, indicating that it was considered to be at high risk for abuse with no accepted medical use. So I think it's important to have an idea of our endocannabinoid system. What is it about cannabis and where does it interact with our bodies? And so we have something called an endo, meaning internal cannabinoid system. And that is composed of receptors, the most notable of which are CB1, which is found primarily in our nervous system, and CB2, which is found primarily in immune cells. Another part of this system is something called endocannabinoids. And endocannabinoids are internally produced chemicals that have been dubbed cannabinoids because they're very similar to chemicals that are found in cannabis. And finally, the third part of this system are enzymes that either bring our internal cannabinoids into being, help them be produced, or actually get rid of them when they're no longer needed by that system. So what's unique about cannabis is something called phytocannabinoids. So phyto is Latin for plant. So what this is essentially referring to is that there are substances within cannabis, the cannabinoids, that are actually able to either directly interact with our cannabinoid receptors internal in our body, or they share a chemical similarity to the cannabinoids that we produce, or that do both. And there are over 110 phytocannabinoids in the cannabis plant that have been identified so far. Some of the properties of the cannabinoids include pain relief, anxiety relief, anti-seizure, anti-nausea, anti-inflammatory, antioxidant, potential anti-tumor effects, and neuroprotective effects, or protection of the nervous system. So I'm going to talk a little bit about the most studied cannabinoids. So first off, there's THC, which is very well known. The activity that it has is at our CB1, which is the nervous system activity, and it's very strong activity at those receptors, and more weak activity at the CB2 receptors in the immune cell. And major effects of THC include psychoactive effects, anti-nausea, pain relief, antispasmodic, and anti-inflammatory effects. And there are associated actual prescription drugs with THC. These include Marinol, which is best known. It's a synthetic version of THC. Sesamet is another THC, and they call it analog or synthetic. Nabilone is the other name for that. And then Sativex, which is a prescription medication that was approved initially in Europe and is available in over 30 countries, but not in the United States. And then levonorgestrel, which is something that only ever was used in research and was never released as a prescription medication. And then there's CBD, the second most studied or well-known cannabinoid, and it has very weak effects at both the nervous system and in the immune cells. But it's also known for pain relief. It may be protective of the nervous system. It has anti-seizure effects, anti-anxiety effects, and anti-nausea effects. And as you see, there's two prescription medications associated with CBD. Sativex, again, the same one that also contains THC. And Epidiolex, which is more recently studied and has been used to control uncontrollable seizures in pediatric patients. So the next thing that's unique about cannabis are its terpenoids. And so the terpenoids are chemicals found in the cannabis plant that are responsible for its characteristic or unique smells, and some would say tastes. And some of these terpenoids include limonene, myrcene, pinene, linalool, the caryophyllins, there's two different ones, nerolidol, and phytol. And what's interesting about the terpenoids is that they're not just found in the cannabis plant, but they also happen to be found in a lot of other botanical species, many of which are ones that we might use. For example, limonene, as you might guess, is found in lemons. Pinene is found in pine needles. And linalool is something that's found in lavender. So some of the effects of the terpenoids include that they can contribute to anti-anxiety effects, anti-seizure effects, or anticonvulsant. They can be antidepressant, they can be sedative, anti-inflammatory, bronchodilatory, or opening up your bronchial passages, antifungal or antiprotozoal, essentially an antibacterial type of thing. And so want to just point out, for example, that myrcene is another well-known terpenoid that happens to also be found in hops, and is something that's known to be very sedating. So a lot of folks who really want to see cannabis used as a whole product, they're interested in what is termed often the entourage effect, and it's the intersection between cannabinoids and terpenoids in that sort of sweet spot in the middle, where the two of those chemicals come together and they create a more synergistic or a holistic effect on the body. So some noted entourage effects include, for example, that when you have THC and CBD in a preparation at a 1-to-1 ratio, meaning for every 1 milligram of THC, you would also have a milligram of CBD, it reduces some of the anxiety and memory issues associated with THC, so that CBD helps attenuate that, and it may actually help increase pain control. And looking at some of the terpenoids, caryophyllin, when it's fairly high in a cannabis preparation, may also help to decrease pain and inflammation. Linalool, limonene can help reduce anxiety. Again, myrcene is very sedating and decreases pain, and pinene can help reduce memory issues. So I'm going to talk for just a moment about what's in a name. So a lot of people talk about cannabis and they talk about cannabis indica and it does this or that, and they talk about cannabis sativa and they talk about strains. There's a lot of crazy strain names out there, such as blueberry kush, for example. So a lot of strain names are named after fruits, probably because of that characteristic odor of those terpenoids. But newer terminology that's really being encouraged in the scientific literature is to refer to chemobars instead of strains. And what that means is chemical varieties. That's what that name is intended to convey. And so there's three main chemobars of cannabis. Type 1 would be the predominant cannabinoid would be THC. That would be very high in that particular type of chemobar. Type 2 would have a more almost equal quantities of THC and CBD, and type 3 would be predominantly a CBD for cannabinoids and much lower in THC. Additional distinctions that you can make beyond these chemobars would be to look at the terpenoid profile. So this is an example of a terpenoid analysis, and what you see, of course, is that relative to other terpenoids in this particularly analyzed product, limonene is very high. If we recall that limonene is something that can help reduce anxiety, we also might look and see that the next highest thing is the beta-caryophyllene, so that might indicate to us that this preparation could have an increased ability to reduce pain. And you have a fair amount of myrcene relative to some of the other ones, so it might be slightly sedating. So that's just to give you an example of what using a terpenoid analysis might tell you about a particular preparation. So when we're talking about the evidence, and I really like to look at the scientific literature rather than anecdotal evidence in talking with folks about cannabis and how it might affect us, I want to note that available studies will most often include synthetic THC, either dronabinol or nabilone preparations. Some studies will include extracted THC with or without CBD. So this would be extracted from the plant. It may still just be THC, even though it's not synthetic, or THC and CBD. It may not include all of the terpenoids or some of the other cannabinoids that could also be playing a role in how cannabis affects the body. And less often you'll see studies that include the whole cannabis plant. So the first thing that I like to also do is talk about mostly what people ask me about using cannabis for. So during and sometimes after treatment, people experience various things, including on this slide we're talking about nausea and vomiting. So I like to address what the research has to say about those things. So specifically, you can see that there's multiple different studies or reviews looking at various cannabinoids and the effect on nausea and vomiting. And what you're seeing is that for the most part, people prefer the cannabinoids to some of the traditional anti-nausea drugs, and they're often found to be more effective than some of the traditional anti-nausea drugs. And most notably, at the bottom, you see that dronabinol, which is the synthetic THC, was studied against ondansetron, which is the most common anti-nausea medicine used in chemotherapy situations, and a placebo, which would be basically like a sugar pill. And the dronabinol was slightly superior to the ondansetron, and of course, both of them were much better than the placebo. So in essence, cannabinoids can be very helpful for managing nausea and vomiting. So a couple of areas that people ask me about include, will it improve my appetite? And might it include or improve, my sense of taste? And so I've listed a couple studies here. The first looked at appetite, and it looked at dronabinol versus another often used appetite stimulant called megestrol acetate. And what was found is that the megase, which is the short name for that, was increased appetite much better than the dronabinol. And I think it's worth noting that this particular study was done in advanced cancer patients, so people who were pretty far advanced in their diagnosis. In another study, THC with CBD or THC, so THC alone or THC with the CBD versus a placebo was used to determine if appetite would be improved, and there was no difference in any of these preparations. But I think it's important to note that they used a very low dose, only 2.5 milligrams. And in other studies, in different situations, again, like with HIV patients, for example, it was found that you needed to use 2.5 to 5 milligrams up to twice a day before you saw an improvement in appetite. So it may be that this study doesn't show an improvement in appetite, because the dosing wasn't really optimal. And then finally, in a very, very small study, THC was compared to a placebo to see how it would affect taste and something called the chemosensory response. So this is the taste and smell when you're eating food, and that's your chemical sensory response. And it was found that THC was certainly better than placebo at improving taste and smell. Patients would say, or excuse me, research subjects would say food tastes better at a significantly higher amount, 55% versus 10%. And premeal appetite scores were better. People had a better appetite after using the THC than placebo. So another really common reason that people like to use cannabis is to deal with pain or neuropathic pain. And so these are various systematic literature reviews, and what you see is that in each one of them, except for the last one, the cannabinoids were mixed. So they would be either dronabinol or nabilone, or possibly there would be a few studies included in the review that might be whole cannabis. And what you're seeing with the first line there is that looking at cancer and other types of pain, cannabis appeared certainly more effective than a placebo, but the authors felt that there were significant adverse effects and that the benefit of using it may be not so great in terms of the burden of the adverse effects. In another study looking at neuropathic pain, 15 out of 18 trials found a significant but modest effect against neuropathic pain. And in that particular review, they didn't find any severe adverse effects. People didn't drop out of the study, and people often drop out of studies for opioid pain medication. So I think that's worthy of note. And then in the third review, 27 out of 38 randomized control trials, which is sort of a gold standard for research, found significant relief when various cannabinoids were used for cancer or other types of pain against a placebo or an active control, which may have been an opioid. And then finally, there's a review of 6 randomized control trials looking at cannabis itself, whole cannabis, against neuropathic pain. And all 6 of the randomized control trials showed a significant relief from pain. And 3 of those studies had what was considered clinically meaningful relief. So clinically meaningful is where the effect of the cannabis was more than twice that of a placebo. So I've showed you those percentages there. So cannabis may be effective at helping with pain and neuropathic pain. I also want to point out some work that was done that was an observational study. So what's different about this study than the ones that we just looked at is that in this situation, patients were able to sign up to be able to use medical cannabis. And they were initially queried about their symptoms, and then 6 to 8 weeks after they were using medical cannabis, they were queried again about their degree of symptoms. And what's different again is that they were not beholden to a specific dose, as was happening with many of the other studies we just looked at. People were able to titrate, use the quantity of cannabis that actually helped them to maintain or manage their symptoms, and to the point that they were comfortable with the other effects of cannabis. So what you see here is that for most of the symptoms we've talked about so far, nausea, vomiting, anorexia, which is poor appetite, and weight loss, there's a decrease in the number of people experiencing the moderate amount of symptoms and an almost similar increase in the number of people having no symptoms. So people are going from moderate symptoms to no symptoms after 6 to 8 weeks of cannabis use. When it comes to pain, what you're seeing is that a large number of people with severe pain actually are ending up having a lot less severe pain, either no pain or only moderate pain. So this is not considered necessarily a gold standard for study, but it does give you an idea that when people are able to adjust their own dose, they may have more significant improvements in the side effects they're trying to manage. So I want to address a common question I also get, which is cannabis potentially a cancer cure? And a lot of people do hear about things like the Rick Simpson story or the Rick Simpson oil, and the claims that cannabis may actually be able to cure cancer. And what I'd like to point out is that there's very, very limited what we call preclinical evidence at this time. And preclinical evidence is evidence either in essentially a test tube type of situation or in a rodent study, like a rat or a mouse. And that information can not be directly translated out to the human body. One very small study, I want to say only 9 people, looked at in the situation of glioblastoma, brain tumors, whether THC might be safe to use. And this is where a lot of people are getting excited, is because in this study, a couple of people lasted a lot longer, lived a lot longer after this research than was expected for their condition. However, they were only just looking at adverse effects and whether the use of THC in that situation, whether they could increase the dose and what the effects were. In no way were they poised to have statistical significance or meaningful information about whether THC could be used to cure brain tumors. So there's other tumor types that have been looked at in test tube situations, and it does appear like there may be some promise, but there's a lot more research that needs to be done, and I think it's important to know that while the potential is there, there's no certainty, and it's not something you want to rely on as a cancer cure. So I want to switch gears and tell you a little bit now about various administration routes that people use cannabis. And it's all, the devil is in the details, right? Details. So the first route would be inhalation. We're taking it in via the lungs. The forms of that, smoking or vaporizing the cannabis. It's important to note that in this form of taking in cannabis, the onset is very quick, which is what some people like about using, say, a vaporizable form of cannabis or smoking cannabis. 5 to 10 minutes, people have got maximum effect, and the duration is also fairly short, which is sometimes nice. I want to note that vaping is certainly thought to be less harmful in terms of the byproducts produced than smoking cannabis in the traditional way of like a cannabis cigarette. I want to talk next about oral tissue absorption. So this would be things like tinctures, lozenges, or sprays, where these things go into the mouth and the absorption is in the tissues of the mouth. Onset is a little bit longer, 15 to 45 minutes, and duration is quite a bit longer, 6 to 8 hours. So one of the drugs that we already talked about that is not approved in the US, but in many other countries, Medicinal, is something that's been very well researched, and it's a spray product that will spray into the mouth. With other products, such as some of the ones available in the US at medical cannabis stores, there haven't been a lot of research around tinctures or some of the lozenges or things like that. But there is enough to know that we can absorb the cannabinoids through the mouth, and we know what this onset and duration is. Next, we move on to the GI tract or the gut. So this is when we take something like an edible medicinal, maybe a brownie, maybe a capsule, and we swallow it all the way, and the absorption is in our gut or through our stomach and the blood flow that goes from the stomach. These are really unique in that it can take anywhere from 1 to 3 hours for people to have an onset of the effect, and the duration again is pretty long at 6 to 8 hours. Worth noting too that bioavailability, meaning how much medicine a person would absorb in this form, is really variable. Some people might absorb only 4% and some only 20%. What's important about that is to know that if your neighbor tells you to take a certain quantity, what if he only absorbs 4% and you're a 20% absorber? So you may want to take, what anybody suggests to you, take a quarter of that the first time you're trying a product if you've never tried it before. I also recommend that people think about the fact that it can take 1 to 3 hours before you get the full effect, because some people will be impatient, and after 30 minutes they'll take more, and then after 30 more minutes they'll take more, and the next thing you know, they've got so much medicine in it that they're very uncomfortable with the side effects. So very important to understand the differences in onset and duration for edibles in particular. There's also skin. This comes in the form of creams, ointments, or patches that can be placed onto the skin. And we don't know as much. It's very variable in terms of how quickly you would feel the effects and the duration. But we do know that skin application is much less systemic. Not very much of it gets into the bloodstream. You mostly will have local effects, but there's also really limited research on this. So we need more information to verify the degree to which cannabinoids absorb through the skin. And then there's also the rectal mucosa. This is basically the form of suppositories. And again, the onset of effects really varies, but the duration can be up to 8 hours. There's a particular chemical form of THC where it's attached to something called succinate that appears to be best absorbed. So some cautions around these different administration routes. There are products called DABs, or what they are, they're volatile concentrates or very concentrated THC products that essentially what people do is they heat them up on a very hot surface and then inhale. And oftentimes these types of products are extracted via solvents, liquid gases, and sometimes carbon dioxide. The concerns around this is that one study took a look at various samples of these volatile concentrates and found residual solvents in over 80% of samples. And these solvents, like hexane and butane and also the liquid gases, are not healthy things to put in your body. They also found pesticides in 33% of samples, including one that was not listed with the EPA for use on food crops. So if it shouldn't go on food, I would assume it shouldn't go in our body. It's also been found that people may have increased adverse effects because they're getting a lot more medicine more easily because this is such a concentrated form of taking in the cannabinoids, particularly THC. And some physicians who've done a lot of research in the area of cannabis as medicine have suggested that volatile organic concentrates are best avoided. They're really not for use as medicine. They tend to be more recreationally oriented products. So I think it's also important to point out that smoking of cannabis or vaporizing of whole cannabis, cannabis can grow bacteria and molds on the green bud, and there have been a few case results of aspergillus, which is a type of mold that appear to have been transmitted to a patient via inhaled cannabis. And aspergillus can be fatal in people who have a compromised immune system. In Israel, however, they've been looking at the ability to sterilize cannabis before using it in that way, before actually smoking it or vaporizing the whole green bud. And they have been able to find that sterilization could work. I don't know that we're doing it in the U.S., but a lot of states are really trying to make sure that we're testing cannabis products so that we know whether or not there are bacteria or molds present. So that's something to look for. Does your state require testing if you're going to be using that kind of medicine? So I also want to caution about taking in edibles as your medicine. So there's something that happens when we take medicine through the stomach. You get something called first pass metabolism. And first pass metabolism is when the blood flow from the stomach where the medicine is absorbed goes straight to the liver, first off. And the liver then metabolizes the THC into something called 11-hydroxy-THC. 11-OH-THC is the chemical abbreviation for that. And 11-hydroxy-THC is a very potent psychoactive in and of itself. And it also reduces the bioavailability of THC, meaning you're not getting the effect of the THC that you want, perhaps, for pain or nausea relief, but you are getting a lot of those psychoactive effects that some people don't find very pleasant. Because this can be a really variable thing with the difference in absorption between people, it can be much more difficult to determine a proper dose using an edible. So it doesn't tend to be my favorite thing to suggest people use, especially if they have never used cannabis before for their medicine. So a couple of other things, labeling inaccuracies have been found amongst edible products. One study took a look at some edible products from both California and Washington dispensaries, and they found that only 17% of products were accurately labeled and 23% were under-labeled, meaning that many products had higher THC content than the label said. So if you have an idea of how much you want to use and what you tolerate, and then you get something that's under-labeled, you can end up to basically overdosing yourself. And then the variability in labeling can also contribute to difficulty dosing, knowing, is this product going to be the same the next time I buy it? So I think that's just a good word of caution. And then the other forms, suppositories and rectal use of cannabinoids, again, if somebody's actively getting chemotherapy and maybe immune compromised, typically your doctors will be asking you to avoid any form of rectal medication. They will even give you a suppository form, typically for nausea relief. So not something to be using if you're actively getting treatment and compromised. So now I want to talk a little bit about contraindications and adverse effects. So of course, if somebody is allergic to cannabis itself or the vehicle that cannabis is being delivered in, you wouldn't want to take it. We still urge people not to use cannabinoids for medicine in the situation of pregnancy or breastfeeding. If you have major heart or respiratory issues, cannabis can make those worse. Also, if you have liver or renal issues. And then for any mental health history in the family or for yourself, if you have a history of schizophrenia in your family or for yourself, bipolar disorder or depression, cannabis could potentially make those situations worse as well. So you want to really probably not consider using cannabis in those situations. If you have a history of heart conditions that aren't active, or angina, which is chest pain, or high blood pressure, or if you have issues with asthma or chronic obstructive pulmonary disease, you want to use cannabis with a great deal of caution. Again, it can impact blood pressure, sometimes lowering it beyond where it should be if you're already on blood pressure medications. And certainly, inhaled cannabis might be activate your asthma or cause some issues with your lungs. So something to think about. So also want to list some common adverse effects. So the most common are fairly benign: drowsiness and fatigue, dizziness, anxiety, nausea, cognitive effects such as confusion, disorientation, sometimes hallucination at its worst, or impaired memory. Also, if you're inhaling a product, you can have coughing, increased phlegm, or bronchitis. Those are the most common. Somewhat common are, of course, euphoria, which some people would say isn't very adverse, might feel good to be a little euphoric, blurred vision, headaches, and then fairly rare are low blood pressure or hypertension, psychosis and paranoia, rapid heart rate, hyperemesis or an increased, a lot of vomiting related to using it. And often the hyperemesis occurs when people are really not clear on a dose that's appropriate for them or they use too much. Also, some people could get diarrhea and experience a loss of coordination and potentially experience falls. Important to also know some cannabis drug interactions. There are drugs that their effects are increased by the use of cannabis concurrently. So if you're using THC at the same time as alcohol, benzodiazepines, or opiates like codeine, fentanyl, or morphine, the effects of those things are going to be increased by the THC, and that can be very detrimental because all those things can be highly sedating. And then CBD typically isn't used at a very high dose for management of things like neuropathy or pain or nausea, but it's just worth noting that when it was studied in high doses for the use against seizures, a certain benzodiazepine, clobazepam, would need a dose reduction because it increased sedation. So just something to know that CBD concurrent with a benzodiazepine may have an increased sedative effect. A little bit about dosing. So the mantra here tends to be start low, go slow, and stay low. So doing so, starting at a very low dose, very slowly increasing over a couple of days the dose that you're using, and not really going beyond a quantity that helps to manage the side effect you're trying to manage, helps you limit things like fatigue, high heart rate, dizziness, and it can aid in the tolerance to the psychoactive effects as you sort of adjust to those effects when you're starting to use those. You might also consider type 2, or a chemovar that is pretty much similar in its THC and CBD content. Or some people may want to opt only for a type 3, which is just CBD. But knowing that when you have CBD at the same time as THC, the CBD tempers those unwanted psychoactive effects of the THC, and you can be more comfortable. For chronic issues, like chronic pain, some people may find that oral products are a mainstay of therapy because they have such a long duration. But again, I would give you that caution of if they're tolerated, because when you take an oral product, you do sometimes get that increase in psychoactive effect. And then finally, it's thought that for acute symptoms or breakthrough symptoms, when you're using something for pain, for example, and then you have some breakthrough and you can't take pain medicine for a few more hours. A quicker acting like vaporization, vaporized product, again, not in the form of an organic concentrate, but you can vaporize. There are products that you can get that are not as concentrated and that you can use as a vaporizer. So further, when you're starting and increasing THC dosing in particular, it's suggested you initially start at bedtime, and the first couple of days a very low dose would be 1.25 to 2.5 milligrams, even lower if you're over 65. And if you're tolerating that, after a few days, you may increase slowly by 1.25 to 2.5 milligrams every couple of days until you're getting the desired effect, whether it's for pain or nausea or appetite. If you're using it in the daytime, then you want to just start with a single dose of 2.5 milligrams of the THC for a couple of days, then perhaps go up another 2.5 milligrams, and you can work towards 2.5 milligrams 3 times a day. Slowly increasing towards 5 milligrams 3 times a day. That tends to be a quantity that most people will get the effects they're looking for, and most people seem to need to go over that. Again, if you include CBD in equal amounts, it will reduce those THC side effects. And then it's been found in research that amounts more than 20 to 30 milligrams of THC per day increase the adverse side effects, the unwanted effects, and really don't improve the desired effects. CBD has a lot fewer side effects. It's not the type of psychoactive effects that THC has. It does help tamp down anxiety, and it can facilitate sedating. We don't have very well established dosing guidelines when using it for things other than seizures. So in terms of trying to use it for anti-nausea or for neuropathic pain, or give the sedative or anti-anxiety effects, we just don't have good information on doses. There may be a benefit of doses somewhere in the range of 5 to 20 milligrams per day. Ideally, you divide your dosing into 2 or 3 times a day dosing. So, for example, if you're taking 10 milligrams total, you might take 3 milligrams 3 times a day or 5 milligrams twice a day. Again, just pointing out that if you're using any type of benzodiazepine, CBD may increase the sedation, but that typically, where that was seen was when the dose was higher than 4 milligrams of CBD. And finally, kind of important that if you're using THC-based products, you don't drive. So our officer here is saying, I couldn't help noticing you're driving exceptionally well. The gentleman says, hi, the dope frame. He's on to us. So very important that you stay safe, and if you're using THC products, that you don't drive and you harm yourself or others. So in summary, cannabis has a very long history of being used for medical purposes, and there is some scientific evidence that it could be effective for some conditions. Important to note that pros and cons include that in the various modes of administration, there are differences in the effects on the body, potential differences in contaminants, and variability, whether it be in labeling or how someone will store those products. And you need to think about your individual medical history, whether or not perhaps cannabis is not indicated for you to use, whether you need to be very cautious because of your medical history. And finally, the best dose is the one that is the lowest, giving you relief, but also good tolerance to the side effects. You don't need to use a lot of cannabis. You just need to use enough to get the effect that you're looking for. And finally, I wanted to include some resources, some websites, and a couple of books that are excellent, and an article from authors McCallum and Russo giving you information about medical cannabis administration and dosing. And so I want to thank the Ovarian Cancer Research Association for having me on this very wonderful virtual platform, and I hope this is very helpful for you. And do please take a look at some of these great resources if you're thinking about using medical cannabis. Thank you so much.